It's like a second home, and although we thankfully haven't been here very much lately, it's always a fantastic environment. We absolutely love every member of staff. We have never had a negative experience here. I recommend the place, which is an odd thing to do when talking about a hospital, because it's somewhere you don't want people to visit. But we know that every time we come here, we are going to be looked after absolutely brilliantly.
I love coming to work. I'm passionate about seeing my patients. That gives me a buzz. We're all part of the community. The hospital is it's embedded in the heart of the local population. And you know, that relationship I think is really special.
There is a determination and energy within the trust to really succeed and get things right. You know, I'm aware that things perhaps haven't been as good as they should be or even could be, but there is this passion to really achieve the ultimate outcome for patients, staff and obviously visitors as well.
Have you ever stopped to think what angels do all day? Perhaps you've pictured fluffy clouds and golden harps to play, welcoming in through heaven's gates our friends that go to rest, whilst looking prim and proper in their Sunday best. Well, whilst this may indeed be true, it's only half the story. Here with me and you on earth, they're hiding from the glory. All dressed in white? Well, sometimes yes, but other colours too, like purple, grey, green and red, and different shades of blue.
Brighter, it's a brighter outlook, I think, on everything, and renewed energy to go forward.
Positive, definitely.
I think there's a massive change. Wherever I go, I see people are engaged and they are probably saying the same thing.
Yeah, we've started a better care pathway for women who require high dependency care. Rather than before they were moved to the H unit at Burton, we've actually trained all our midwives to be able to provide that care on here. So obviously gives them a better continuity of care and they're being cared for by midwives, which is appropriate. So that was a good thing that we've brought in recently.
Where I see pharmacy in the future in hospitals going is the pharmacy team becoming more and more embedded within the ward teams. I already have pharmacists who go up to the wards and they provide a clinical pharmacy service.
We have revision rates which are less than half the national average, both in hip replacements and knee replacements. We have very high patient-reported outcome satisfaction measures, and on a sort of comparative data, we sit very well above, probably punching above our weight as a hospital, both in numbers and in outcomes.
Well, I work on X-ray and CT, and when I go and fetch a patient, I always call them by the first name, never by the surname. And once I've got them into the chair, I'm wheeling them down in a bed. I always say to them, how long have you been in? And they always answer back, just to make them feel comfortable. You know, you've done something good for the hospital, haven't you? You brought them down to X-ray and they're finding out what's wrong with themselves.
It doesn't matter who you are, what colour you are, you should always respect the people, really.
We're very proud of the care we deliver. We're passionate about being patient-centred and actually putting the older person first. Quite often we see in care that it's a conveyor belt. It's not here. We're actually individualising our care and we're passionate about treating our elder population with respect.
We do love working here. It's a community. We see the same women again and again. We're delivering our children's children, and it's a great team to be a part of.
When they get discharged from our ward, we get cards, we get chocolates and all. So, you know, it's things like that. Some of the patients don't want to leave. You know, they do like to stay on the ward, and we do, you know, have patients who are on the ward for a while. So we do follow their journey.
Determined.
Driven.
Renewed.
Inspired.
Optimistic.
Excellent. Confident.
Driven.
Proud.
Excellent.
Opportunity.
Determined.
Excited.
I am, don't recall this, but I am genuinely excited about the service we deliver, and we've got quite a few projects coming up, and we're having a bit of a refurb, and we've got a new pool coming, and we're going to relaunch the pool birth service, and that is so exciting as a team. We're meeting tonight out of work to discuss our future ambitions. So we've always got something that we aspire to, and we're always looking to develop the service, and that excites me, and I find it really inspiring.
Sometimes angels work in teams and visit of a morning to double check that no one's missed and include you in their talking. Undercover angels really are a secret, so much so that if you ask, they really won't reveal it. So if you think you spot one, remember what to say. Thank them for their caring ways before you're on your way. For if you do that simple thing, then wait a little mo, you'll notice that they lift up a bit and soon appear to glow.